Due to the current situation regarding the novel coronavirus, many of you might be wondering whether yourself or your loved ones are at risk of catching COVID-19. Because this illness may present with symptoms similar to those of common cold, it can be helpful to categorize patients into low-risk and high-risk groups, in which each group is managed differently. The following conversation is an example of how a low-risk patient can be managed in a primary healthcare setting. You're Miss Panpaporn, right?
Yeah, that's right.
And you're 25 years old?
Correct.
All right, nice to meet you, Miss Panpaporn. I'm Dr. Ploy Pailin.
Nice to meet you, doctor.
What brings you here today?
I think I have a slight fever and a bit of a runny nose since yesterday.
Okay, can you tell me more about other symptoms you might be experiencing, like sore throat, coughing, muscle aches, loss of appetite, chest pain?
No, just a runny nose and a bit of fever, that's all.
Okay, and have you noticed any changes in your sense of smell or taste at all?
No, except maybe when my nose gets congested.
Do you have any other medical conditions?
No, I don't.
Okay, and are you currently working?
Yes, I work as an accountant at a private company.
Okay, does that mean that you have to go into the office regularly?
No, my company has a work from home policy, so I haven't gone to the office in a while now.
Okay, I see. Do you still leave the house at all?
I still go out to buy things occasionally, but I always wear a mask whenever I do.
Okay, so when you go outside, do you normally take public transportation or do you drive?
No, I drive.
Okay, so over the span of 2 weeks, have you been to any known high-risk areas like the markets or hospitals, or have you come into contact with anybody who's sick or has recently traveled abroad?
I've been staying home almost every day.
Okay, and do you live alone?
I live with my parents and 2 siblings.
And everybody is healthy?
Yes, they are. They are all healthy. Especially with the situation right now, we are pretty afraid of getting sick, so we try to avoid any unnecessary contact as best as we can.
Okay, that's great to hear that you're aware and protecting yourself. Now, if you don't mind, I'd like to do a little physical examination.
Yes, please go ahead.
Okay, so from the physical examination, your body temperature is 36.8 degrees Celsius, which is within the normal range. There is a little bit of clear discharge in your nostrils, but your lungs are clear and everything looks good. So from the physical exam results and the history you gave me earlier, it seems like what you have is just a common cold.
But can you get me tested for COVID-19 just to be sure?
Well, normally for a case like yours, which is very mild symptoms and no contact history, what I would recommend is to not get tested because even if the test result is negative, it doesn't guarantee that you don't have the virus. However, if you're worried, what I would recommend instead is just to follow the basic precautions, which is to wash your hands regularly, eat freshly cooked meals, avoid sharing personal belongings with other people, and wear a mask whenever you need to go outside. Okay, and as for your symptoms today, I will prescribe you paracetamol tablets and also decongestants for your nose. Your symptoms should start improving in 3 to 5 days. However, if the symptoms persist or if you develop additional symptoms like high-grade fever, difficulty breathing, chest pain, or diarrhea, make sure to come back and we'll get you tested again, okay?
Yeah, okay.
Anything you'd like to ask?
No, I think I'm good. Thank you very much.
Thank you.